Thank you, Ruby. So, thank you for having us together. We're meeting today because we're discussing this project called Spider. What a cool name. Uh, so, I'm a family doctor in Surrey, and just interested to learn about this. It was Megan Burrows from Doctors of BC negotiating team who shared this with me, this opportunity for doctors to be involved. Ruby, why don't you introduce yourself to the listeners?
Sure. So, hi, I am Ruby Dev. I'm an assistant professor in the School of Nursing at UBC, and I'm also an affiliate member with CHESPR, which stands for Center for Health Services and Policy Research. And I lead a BC Primary Healthcare Research Network here. And SPIDER is one of the study that's part of the BCPHCRN research and quality improvement work.
Wow, wow. So there's a lot of acronyms in there. So I want the listeners to know. So UBC is the University of British
Of
Columbia.
Washington. Oh, sorry, University of British Columbia.
Yes, British Columbia.
I,
And you mentioned another one, which was CHISPR, which is CHSPR.
CHSPR, and it's a center located in the School of Public Health at University of British Columbia. So
Okay. And it,
CHSPR, that's a center, and it's Center for Health Services and Policy Research.
yes, I actually went to one of the CHISPR conferences one
Wow,
time, and I remember that there was a lot of talk about primary care networks, and
that's right.
there was yeah a model for how it might happen. There was somebody lecturing from, I believe it was from Washington State actually. There
Mhm.
was lecture who was lecturing, and I remember getting a recommendation for an economics textbook from that conference a couple of years ago on health policy. Yeah, a very different world from some of the stuff that clinicians have studied before, actually. But it sounds like Ruby, you've been involved in primary care research for quite a while now. Is that right?
For a year and a half now, since I joined
Mm,
UBC.
I
Yeah.
see. Tell me more about what does SPIDER stand for? SPIDER, you said, is one of the primary care research or QI things that's going on, right?
It's a research and quality improvement project. So SPIDER is just an acronym for a study, name of an intervention. So it stands for structured process informed by data and evidence. So just initial of all those that makes up SPIDER, structured process informed by data and research.
Data and research. So SPIDAR, SPIDAR. Yeah.
Data, evidence, and research.
Data, evidence, and then silent A, and then
Silent A and
research. Okay.
research. Yeah.
Structured process
Yes.
informed by data and
Evidence
evidence
and
and
research.
research. Okay. Thank you,
That's right.
Spider. So tell me more about if somebody wants to become involved in Spider, or what is, maybe let's start with this. What is the end goal of Spider? What's the aim of Spider?
So the Spider is a national project actually, which has been running in 7 different provinces across Canada, and BC is one of the node. So BC Primary Care, the network that we have been running here. So we have been leading the BC node of the national project. The main goal of this project is to apply this intervention, which is SPIDER, a quality improvement intervention, and compare it with the usual care that's already happening in the primary care settings right now, and see its effectiveness in how effective it is in reducing potentially inappropriate medications prescription among elderly Canadians who are 65 years of age or older and who have been prescribed 10 plus unique medications per year. So it's mainly about de-prescribing, the main goal. And we are mainly targeting 4 drugs as part of this study. So the 4 drugs are proton pump inhibitors, benzodiazepines, antipsychotics, and sulfonylureas. And we didn't just came up with these 4 drugs. These are the drugs that were identified by choosing Widely Canada and the Canadian De-Prescribing Network as of particular interest. And that's the reason these 4 drugs were selected for de-prescribing as part of this study.
So the acronym of SPIDER, like a structured process informed by data and evidence and research, it sounds like a very general term. It sounds like a process that can be informed for almost any clinical area. But in this portion of the SPIDER research, we're really looking at deprescribing in seniors, some of the more elderly population, and we're focusing on four medications:
Yes.
proton pump inhibitors, like the common proton pump inhibitors, and also antipsychotics
Mm-hmm.
and
Sulfonylureas
sulfonylureas, which are
and
usually used for
benzodiazepines.
diabetes, but
Yes.
they're not as probably not really needed. And then benzodiazepines, which can cause many challenges and side effects, including
Yes.
dependency, which is very risky. Okay, so this is a project really focused on more safer prescribing. And you said that Choosing Wisely Canada has
Yes.
identified these medications as the ones that we could focus. We could get more bang for the buck by
That's right.
focusing on deprescribing of these four.
That's
Oh,
right.
that sounds really exciting. That sounds really exciting. And you said this is a collaborative. So seven different provinces are taking part
Mm-hmm.
in this QI work. Wow.
Yes. So it's a
Uh,
pan-Canadian study. And like many other provinces has progressed to different steps, like for recruiting patients, practices, and BC and Newfoundland were new to added provinces. So we had just started recruiting.
Is there a big time commitment to become a part of Spider? And yeah, is it a big time
Not
commitment?
exactly. So even though the study spans for a year, so it's a 12 months study, but the commitment is not more than, I would say, 12 to 13 hours in a year, which is divided. So practices who participates in this, they have to be joined for SIPSIN. So again, another acronym. Uh, that's I'm sure you are aware of it, and I'm just going to say
I've
that.
heard of things like it's a Sentinel network, data repository, something like that. But please
Yeah,
explain to the listeners what SIPSIN is, maybe even the letters that it makes up, because I can't remember.
sure. So
CPSN
it's
something?
CPCSSN, and it stands for Canadian Primary Care Sentinel Surveillance Network. And
Okay. And so when you say that the doctors have to sign up for it, that means they have to do some paperwork, and then it allows this SIPSIN servers to pull data from their electronic medical records
that's
into the
right.
SIPSIN centralized network for research analysis kind of thing.
That's correct. So we extract completely de-identified data from the electronic medical record used by at the primary care centers by the doctors. And again, this is a national database. It's not only for the BC, but we do what we do from our parties. It's mainly for the BC SIPSIN. So we extract EMR, and for that purpose, practices who would like to participate in SPIDER, they have to provide us a consent. So it's not again a lengthy process. It's just going over the consent, agreeing to it, and providing us the consent to extract the data. Because all these studies will be dependent on electronic medical records, we'll have to be able to identify the patients who have been prescribed those medications. But again, it's
Okay.
completely de-identified data. No one is going to ever able to identify the participants.
Okay. So if a family doctor wants to join this project, they don't have to spend more than maybe 12 to 13 hours actually doing anything. There's probably going to be some orientation session, some education session, maybe some online sessions where they learn
Oh,
of what their team
yes.
might do, like some change package. Is that right?
Sure, I'll just break down the work. So the practices, again, since it's a randomized controlled trial, there will be 13 to 14 hours of work for those who are assigned to intervention arm, but only an hour work for those who are assigned to usual care arm. And again, all these hours that I'm talking will be spread over the period of 12 months. So those in the intervention arm will be doing baseline provider survey, which may only take 15 minutes. Then we will be sending 2 audit and feedback reports to the practices, and practices or practitioners only will have to review that record, which we anticipate might take 2 hours of their time. Then there are 4 learning collaborative workshops, and this is the main highlight of this study, where a quality improvement coach will work with the practitioners to develop that the prescribing objective. So that might take 7 to 8 hours in total. So let's say 2 hours each for 4 learning collaborative workshop, and that's why we said 8 hours total. Finally, there is a post-intervention survey that might take another 15 minutes, and finally, post-intervention provider focus group discussion that will take 1 hour. Beside these hours, if practitioners would like to touch base with our QI coach, it's completely upon the QI coach and the providers as required. Otherwise, this is all the time requirement for the participation.
I see, I see. If a doctor did want to participate, are there any CME credits or payment available to participate?
So the payments is mainly to give as an honorarium for their time, mainly when they complete the survey or when they participate in focus group discussions. But beside that, the main highlight is whoever practitioners or providers who join this, they will get Main Pro M1 credits, and it's up to 16.5 Main Pro credits.
Okay, so that's great. 16.5 Main Pro credits. That's a fantastic value, and that's almost like 2 credits per hour of participation potentially. Of
Yeah.
course, that's for the intervention arm. If you're in the usual practice arm, you probably won't get that many credits. What about you mentioned the honorarium. How much honorarium is there?
It's $50 for participating in that focus group discussion, and any cost associated with travel time or parking fee if we decide to do it in person, but it can also be done via Zoom or phone.
I think you said $150. Is that
50.
right?
Sorry, 50. Since this is a research project, we don't have too many funding for even the honorarium, so it's mainly 50.
Oh, $50. Okay, $50 for and that's it. It's just $50 and then 16.5 Main Pro credits, yeah?
Mm-hmm.
Okay,
and
great.
another 25 for travel or anything associated cost.
Thank you for answering my questions today. Is there anything else you'd like to tell me about Spider?
I think this is really an interesting study that might help in future, both to the practices as well as our patients who have using too many medications, which is not exactly not required for them, but in the long term can do more harm than doing benefits. And even if we can, so whenever we say deprescribing, it's not completely stoppage of the medication, but reducing it in terms of frequency or doses that might help patients for the long term. So
yeah,
I would
essentially you're reducing harm. You're reducing
yes.
possible harms for the patient. So it's improves population health. It just increases a physician's awareness of what they're doing with their prescribing and allowing them an opportunity to make a change with some guidance with practice coaches. Yeah,
That's right. And even for the providers, this is one agenda or one objective that they will get chance to work with our quality improvement coach, which they can apply in future for other conditions with other coaches that they would like to work on or improve in their practice.
these quality improvement coaches, they are UBC trained quality improvement coaches. Is that right?
No, not exactly. We have a quality improvement coach who is actually from Doctors of BC.
Oh, Doctors of BC. Are they part of the practice and practice support program? Is that where the QI coaches are coming from?
We did get them through that program.
Ah, yes.
So they do have experience of doing quality improvement.
Ah, great, great. I think the last thing is, if someone is interested, how do they get involved? Is there a phone number, a telephone number, a person they should call or email?
Sure, they can either email me. So my email address is ruby.dev@ubc.ca. So I'll spell out. So my name is RUBEE.DEV ubc.ca. So they could either reach to me, or we have a BC Primary Healthcare Research Network. And if you just go to that network, we have lots of information about our study SPIDER, and the contact information on the website as well.
Okay, I'm going to repeat your email. It's rubee.dev@ubc.ca.
That's right.
ruby.dev@ubc.ca. Is that correct?
Correct.
Yeah. Okay. Well, thank you. Thank you so much for chatting with me today. And yeah, I hope that we can get some people on. I might be able to join for the business as usual arm of the study because I don't have too much time, but
Sure.
that would be great. That'd be
Yeah,
great.
I
I'll
mean,
email you about it.
it's even up for you if you'd like to join us in this study. That will be great.
Great. Thank you for your time today. Bye, Ruby.
Thanks so much.
Send me the link for the recording. Okay, bye.
Sure.